Thank you all for listening in. There's a lot going on everywhere around the United States having to do with COVID. It's unfortunate that we are here right now talking about this, and we haven't beaten that COVID-19 yet. But it continues in the Midwest. We've seen quite a surge over the last couple of weeks to month. Testing volumes continue to increase. Our positivity rates might be leveling off, but they're still way higher than we want them to be. Our hospital censuses continue to increase, and that's a reflection of the spread in the community and the positivity here that we're seeing in the Midwest. We see that in the Mayo system. We see that especially play out in Rochester and Northwest Wisconsin, but all of our hospitals are really feeling the pressure from COVID-19. When we look at our testing numbers on Sunday, there were about 476 positive COVID-19 tests in our locations total across the Midwest. The test positivity rate for Rochester is around the 10% range. For most of the other Mayo Clinic health system sites, it is around 20%, but we're seeing, it seems the last couple of days, a bit of a level off, and actually we've seen some improvement where we have seen in Southwest Minnesota and Southwest Wisconsin, positivity rates dropping from 20% or higher down to the mid-teens. So this may be a good sign, but we know that these people that have tested positive in the last couple of weeks, that they may become sick enough to need hospital care and certainly need medical care. So we need to be very vigilant and not assume that things are going to settle down. In fact, we'll probably see an increase in the number of individuals over the next couple of weeks, up to next 4 weeks, needing hospitalization. To give an idea of how many tests we're doing now compared to in the summer we usually did about 13,000 to 14,000 tests per week. Now we're doing 36,000 per week. That's how many we did last week. All of our sites together in the Midwest. That's huge. And that's a reflection of more people being exposed to those that they know have COVID or developing symptoms with or without a known exposure. So this is huge, and it tells us that we don't have this under control yet. In order to treat individuals with COVID-19 and individuals without COVID-19, there are 3 things that we need. We need staffing, we need space, and we need supplies. Here in Rochester at Mayo Clinic, we have 18 ICUs. We have a lot of hospital beds, and our health system is well positioned with beds to care for their communities. But all of our hospitals are really stretched. Many are absolutely full at this time. And throughout Minnesota, we are seeing an increase in hospitalizations and the need to bring up more beds for patients. And in fact, in Rochester, in our medical ICU, we are full. We have 32 beds in that medical ICU, and that has been the intensive care unit that we have designated to care for COVID-19 patients. So we have 32 COVID-19 patients needing tertiary intensive care. That's not good. And again, it tells us that we're still in a surge. And in fact, we are right now putting up 12 to 13 more ICU beds in order to care for the patients that we know will be coming to our doors in the next couple of weeks. This has really put a burden on the entire hospital system throughout the Midwest, and as you've seen nationally, the same thing. In our general care beds in Rochester, we have 73 COVID patients, and we are seeing an increase in the number of transfers of patients from outside of our typical catchment area where our patients come from to be admitted into our hospital from communities. We're also adding more general care beds, or we call them medicine beds, but they could be medical or a step up from medical beds, but not quite intensive care unit beds. We need to do this, again, in anticipation of the individuals that have tested positive in the last couple of weeks getting sicker and needing hospital care. Our staff, which is the most critical thing in being able to care for patients, we're also concerned about our staff. As I said, the three things that we need to take care of any patient are staff, space, and supplies. We are most concerned about not being able to care for patients because of decrease in our staff due to COVID-19 reasons, whether it is they are exposed and they're out on quarantine, they're taking care of a family member who has COVID-19, or they have been infected themselves. The infectivity, or where they get exposed, is mostly in the community. It's not at work. It's not an occupational exposure. In fact, 93% of our staff at Mayo Clinic have been exposed in the community and not at work. We're really not seeing exposures from patient to staff. We are seeing it more in the community. And when we do see it at work, it's when our staff are eating and their masks are off. We need to remain vigilant. The most important thing all of us can do to really turn the tide in this pandemic is to mask, social distance, and use robust hand hygiene. This morning, I just looked at a study that talked about the difference of wearing a mask and not wearing a mask and how far apart you need to be. There is no doubt that wearing a mask protects you, but if you have COVID, it protects the people around you. And 6 feet is magical. You need to be at least 6 feet away from somebody in order to prevent getting COVID-19 from them. And we know that there are many who have no symptoms when initially infected with COVID-19. And when we have positivity rates that are above 5% and really above 2%, we know that there are individuals that are in our communities that we interact with daily that don't realize yet that they are shedding COVID-19 virus, and you are at risk. And you may be asymptomatic, shedding virus, putting others at risk. So please wear a mask, please social distance. So I want to talk a little bit about about the numbers in our different hospitals here in the Mayo system. And we have about 255 total COVID patients in the Mayo hospitals in our system right now. I told you about Rochester. We have a total of 109 patients, and I told you about that. Actually, today we have 115, but I'm looking right now at where we were yesterday. So today we have 115 in our Rochester hospital. Yesterday we had 109, and we had 29 in our ICUs. Today we have 32. In Northwest Wisconsin, yesterday they had 79 patients with 9 in the ICU. In Southeast Minnesota, 11 patients with 3 in the ICU. Southwest Minnesota, 38 patients with 5 in the ICU. And Southwest Wisconsin, 22 patients with 1 in the ICU. What really worries me is that this isn't just an adult disease. We're seeing more and more pediatric patients testing positive for COVID-19. And in fact, today we have 3 hospitalized pediatric patients in our hospital with 1 in the pediatric intensive care unit. And I want to just give you some data. I have to look down to give you this data. But if we look at our regions of the pediatric patients and dividing them into those that are less than 10 years old and those that are between 11 and 17 years old, in Minnesota, we're seeing a gradual rise for those less than 10 years old from 7 to 8%. And for those that are greater than 11 years old, we see a rise from 15% to 17%. In Wisconsin, it's a little bit of a different tale, and that they're seeing a bit of a drop in their pediatric population. It's still a high percent positivity, no question about it, but going in the right direction. In Wisconsin, for those less than 10 years old, it has gone from 12 to 14%. And for those greater than the age 11, so 11 to 17 years old, it's gone from 26 to 22. That's a big jump. So that is fantastic. The bottom line is our hospitals are very busy. Our healthcare workers are very busy. We know much more now than we did in the spring about how to care for COVID patients, but we're still seeing a spread in our communities. I also want to say that we are managing hundreds and hundreds of patients in the outpatient setting who have COVID-19. We monitor them, we talk to them twice a day in order to determine if they are starting to decline, and if they are, to catch it early, and then either have them come to the hospital or treat them as an outpatient. We also are in a better place now because we have better treatments for COVID-19 positive individuals. Remdesivir, which is an antiviral medication, was initially just allowed to be administered in the hospital. Now you can initiate it in the hospital for someone who has a decline in their health status due to COVID-19. They're admitted to the hospital, they can receive remdesivir, but then be dismissed to the outpatient setting if they're well enough to get the rest of that infusion, which is 5 total infusions, so 4 more infusions in the outpatient setting. And we have set up infusion centers in each of our Mayo Clinic sites in order to help patients with COVID-19 stay out of the hospital, get out of the hospital, and be well. The other thing is that we are now receiving monoclonal antibodies, which is spectacular because these will help individuals before they need hospitalization. So there are criteria that somebody has to meet in order to receive the monoclonal antibodies, but they can be given in the outpatient setting. You don't need to be admitted. So as soon as you start having symptoms, if you meet the criteria to have the monoclonal antibodies, you can get them. And we have infusion centers around our areas so that our patients who we are following can get the monoclonal antibody. Now, it's important to know that that monoclonal antibody is distributed by the state. They get it from the federal government, and then the state distributes it to regions. You have to receive the monoclonal antibody within your region. And with that, I think I will hand it over for questions.
Okay, I was going to ask you just to clarify 2 things that you mentioned. When you were talking about staff and the number of staff who were out, either due to a COVID diagnosis or exposure, etc. I don't believe you mentioned a number, and I wondered if you wanted to do that just for those who attended last week to be able to compare the situation.
You bet. So total number of staff is the same as last week because some staff come back and some staff go out. So it's about 1,500 staff. But to give an idea of what is going on and how many are getting infected, over the last 14 days, or I should say the last 2 weeks, not including this week, we have had 905 Mayo Clinic staff newly diagnosed with COVID-19. And that accounts for 30% of the total number of staff that have contracted COVID-19 since the beginning of the pandemic. So it shows you how intensely populated it shows how widely spread this is in our communities and how easy it is to get COVID-19 in the communities here in the Midwest.
All right, thank you. The other quick clarification I was going to ask for is when you provided the numbers on the patient census for the various regions and Rochester, that is accurate as of, you said yesterday versus today at noonish?
Yes, it was yesterday at noon, the numbers that I gave.
Okay, yesterday at noon.
Yeah.
All right, sounds good. Okay, I am going to open it up now to the journalists who have attended, who are attended. You can either submit your question in the chat for everybody to see, or just to me privately. I would also offer, we'll try it like this. We'll see how it goes. I know people are recording this for broadcast, so I know we don't want to interrupt any sound bites, but if you want to go ahead and unmute yourself and ask your questions directly, I think that would be fine.
While we're waiting for questions, maybe I'll just talk a little bit about how we have needed to deploy our staff in order to meet the needs of those with COVID-19. And what we have done is we've looked at the positivity rate, we've looked at the number of individuals that we're following in the outpatient setting and the inpatient setting. We've looked at very robust modeling that takes into account the positivity rate within our counties and the counties surrounding us and the states surrounding us to determine how many individuals we will need to treat, how many ICU beds will we need, how many general care beds will we need, etc. And then we have adjusted the rest of our practice in order to meet those needs. So it would be pulling providers from other activities in the outpatient practice to help to go into the hospital or to monitor those that are at home with COVID-19. We have decreased inpatient elective surgery by 30%. Last week by 20%, and then another 10% here in Rochester. And across the health system, depending on what is going on in that community, they also have decreased elective surgeries. The same thing in Rochester. Elective surgeries that would require an inpatient hospital stay. Not emergency surgeries, not urgent surgeries, but purely elective surgeries.
Great. Thank you. Okay, so with the hospital and ICU beds full in some Mayo sites, including like Northwest Wisconsin, Eau Claire, how is that affecting care for the non-COVID patients in that area?
That's a wonderful question. We continue to have capacity to care for anybody who needs our care. Now, that's one of the beauties of our healthcare system, in that we every day there's a constant look at patients around our system. The hospitals, the ICUs, constant conversation, where is the best place for that patient, to make sure that we have enough capacity for patients, whether they have COVID-19 or not, and we move patients based on that. I do urge everybody to see a physician, to see your care provider. If you or your care, someone contact your care team, if you have an exacerbation of chronic symptoms, or if you have an acute onset of acute symptoms, of new symptoms, don't wait. We are already seeing a decrease in non-COVID symptom patients coming into our emergency rooms. And we think it's because they're afraid of COVID. But we are here, we're here to help whoever needs help medically. So please, if you are sick, seek medical care. Call your care team. Go to an emergency room. It's probably best to call your care team unless you are severely sick, in order to get directions of what to do, and hopefully it can be handled without going to an emergency room, which is more convenient for you. But don't delay your care is the bottom line.